I'm Nadine Grimley, and I'm here with John Schultz. He's the Chief Executive Officer at New River Health. So first of all, just give us a little brief history of New River Health.
Sure. Well, thank you. New River Health is what they call a federally qualified health center. We get a lot of funding from the federal government. It was founded back in 1978, started to see patients. So this is actually our 35th year in operations. In 1976, a group of coal miners got together in Fayette County to look at the lack of access to primary care for the coal miners and the population in that area. So came about, they worked with the community and hired some physicians and administrators and opened up their doors in 1978. So what is a federally qualified health center? Federally qualified health center basically came out of President Johnson's war on poverty to help provide access to medical and dental care to the people who didn't have insurance, who were on medical or Medicaid. It provides primary medical and dental care. We get some federal dollars to help subsidize our services for people who don't have insurance, as well as a couple of other benefits. We get some enhanced reimbursement for medical care for people who are on Medicaid. And the unique thing about it is the board of directors has to be made up of a majority of users. So at least 51% of the board have to be users of the services we provide. So the reason behind that is they wanted to have the community have input into the operations and the governance of the organization. So it's kind of a successful model. There's probably about 3,000 of them across the country. They provide care to over 22 million people now in the United States. And we provide services in Raleigh County, Fayette County, and Nicholas County.
Now, why is this type of health care so important for the people here in West Virginia?
Well, West Virginia, as everybody knows, is a very poor state. A lot of people don't have insurance. A lot of people don't have Medicaid. And again, we provide health care, medical and dental care to anyone regardless of their ability to pay. So if you need to see a physician or a dentist for primary care and you don't have any insurance, we will see you and we'll base the fee on your family size and income. The minimum fee is $15 to be seen by a physician. So it's very important because there are a large number of people, like I said, who don't have insurance or who may be on Medicaid.
Now, are there any age restrictions?
There are no age restrictions. We have family practice physicians, we have internal medicine physicians, so we see newborns all the way to geriatric patients. We provide OB services through a contract with an OB group out of Beckley. And we also provide women's health services. So there's no age or sex limitations on the services we provide.
Now let's go further into the services you provide, because not only do you provide OB, but you also provide black lung treatments for the coal miners.
That's correct. Again, going back to the origin, New River was started through a group of coal miners, and we do have a black lung clinic. Services that we do provide, the services through the black lung program for those individuals who meet the requirements of the black lung program. So that is one of the services we do provide.
Now, what other services can you talk to us about that you provide?
We provide basic primary care medical services. We provide primary dental services, basically cleanings, fillings, crowns, root canals, those type of things. We provide behavioral health services for individuals, drug and alcohol services. We also have 2 pharmacies that we provide pharmacy services, and that's another benefit as a designated federally qualified health center, is we are able to purchase pharmaceuticals at a very low cost from the federal government and be able to pass those savings on to our patients who don't have pharmaceutical coverage.
Okay, and just talk to us about how you're able to operate. Where do you get your money to function?
We get a federal grant of about $1.2 million a year to help subsidize the services we do provide to people who are on a sliding fee scale or who don't have insurance that don't qualify for the sliding fee. We also get about $350,000 from the state to provide care for those individuals who don't have insurance. And we also get some black lung money as well as some other federal and state grants and private foundation grants to help with some of our services. But a lot of our patients do have insurance, private insurance. About 32% of the patients we provide care for don't have any insurance. About 24% are on Medicaid, and about 14% are on Medicare. And the rest is private insurance, which is about 30% of our patients. So a lot of our revenue for operations does come through third-party insurances, whether it's Medicaid, Medicare, or private insurance.
All right, and just talk to us about, there's some legislation that's going to affect the way you perform, function, all that stuff.
Yeah,
the Affordable Care Act, and that's from the federal government, and then Medicaid expansion, and that's from the state.
Sure. What's on, I'll start with the state first because that's a little bit simpler. Basically, the big thing right now that everybody's waiting for is for the governor to make a decision on whether he's going to expand the eligibility for Medicaid. They're looking at moving the eligibility up to 138% of the federal poverty level, which, according to all the studies, an additional 100 to 120,000 people in the state would be eligible for Medicaid, which would be helpful for us because a lot of those people we're providing care for now that don't have insurance or would be eligible for Medicaid coverage, should the governor decide to expand. And hopefully he'll make that a decision sometime in the very near future. The second part of what's happening now is at the federal level, where they're going to be expanding health coverage for people who don't currently have insurance and who aren't eligible for Medicaid. And that's going to start enrollment in that program October 1st. And you hear about these insurance exchanges that they're setting up. People will be enrolled through those insurance exchanges starting in October, and then January 1st they'll actually have coverage and be able to be seen. So when I said earlier we have about 32% of the people who don't have insurance, probably 90 to 95% of those people will have coverage either through the Medicaid program if it's expanded or the expansion of the health insurance through these health insurance exchanges.
So the people will be getting coverage through the federal government?
Correct.
Okay, does this affect the way you operate at all, besides the fact that these patients have Medicaid?
No, it won't really impact the way we operate. I mean, it'll help us with the revenue coming in because now people have insurance and we'll be able to bill whether it's a private insurance company through these insurance exchanges or whether it's through the state through the Medicaid program. So it'd actually be helpful for us. They've done some studies, and for an organization our size, based on the number of people we see that don't have insurance, it would probably be an additional, they're saying probably about $1 million a year in additional revenue that we'd be able to collect through the insurance companies or Medicaid.
Now, just talk to us about how many employees you guys have.
We have about 167 employees. We have a number of sites. As I said, we're in Raleigh, Fayette, and Nicholas County. We do have 6 medical sites, one in Scarborough, one in Whipple, which is right in Scarborough as well, 2 sites in Fayetteville, and then 2 sites in Sophia. Those are our medical sites. And then we have 2 dental sites, one in Mount Hope, right on the main street in Mount Hope, and then the other in Lookout, West Virginia. Those are our dental sites. And then we have 8 school-based health center sites. And those are in Richwood High School, Oak Hill High School, Collins Middle School, Independence High School, Valley, I'll get back to Valley, Summersville, New River Elementary, Mount Hope Elementary, and Coal City Elementary. And we're going to be opening up another school-based health center at Valley Elementary in Montgomery-Smithers area in August of this year.
Now, what do the school-based healthcare centers provide?
School-based health centers provide basic primary care medical, and we also do dental services. We have a hygienist that goes around to the schools to provide cleanings, as well as our dentists do visit the schools and do sealants and fill cavities and that sort of thing. What has to happen at the school-based health centers is at the beginning of the year, There's a bunch of information that goes home with the students. The parents or the legal guardians need to sign a consent form, which basically is a blanket consent that would allow them to provide care to their children at the school-based health center. And those are staffed by nurse practitioners and physician assistants.
Now, do students get physicals done there as well?
Yeah, you can have physicals, sports physicals, immunizations, all those things are provided through the school-based health center
Now,
program.
is it open for all students in the school-based health center?
It's open to all students in that school or school area, but they need to sign all the appropriate paperwork in order to come in and be seen by the practitioners that are there.
All right, and you also have pharmacy locations. Talk to us about where those are.
Yeah, we have 2 pharmacy locations. One is in Scarborough, right next to our Scarborough medical site, and the other pharmacy is in Sophia, right next to our sites in Sophia. And again, it's a very good program for our patients. We are able to purchase the drugs at a very low cost and able to pass some of those savings on to our patients who don't have prescription coverage.
All right, and you said you do school outreaches and community events, and you don't have dates yet, but
Right.
Where can people go?
Well, the schools do outreaches. We have outreach. The Black Lung program does a number of outreach programs. And again, we have some things coming up. I just don't have any definitive dates yet, but we do a number of outreach programs. We do group visits for different chronic diseases as well, whether it's diabetics or congestive heart failure or pulmonary issues, but we do all of that as well.
All right, well, thank you so much, and stick around. We're going to take a quick break, but we'll be right back.